Hey, what's up everybody? This is Dr. Andrew Kim, MD. I'm a board-certified psychiatrist, and I've also worked as a clinical research investigator in the field of postpartum depression. And that's what today's video is going to be about, postpartum depression. We're going to do a brief overview of some of the aspects of this. Now first, let's break down the term itself if you're not familiar. So postpartum means the time after delivery, or after delivering your baby. So postpartum depression is a specific type of clinical depression that occurs in some mothers after the delivery of their child. So let's go over some of the signs and symptoms that one can expect if you are going through postpartum depression. Now, if you've had a handful of what we're going to review for at least 2 weeks or longer, and it's significantly impacting your functioning, you may be going through or are at risk of postpartum depression. So first of all, one of the first and most common signs and symptoms is a persistent depressed mood. So not just sadness here and there, but a persistent and pervasive depressed mood for most of the day and for most days of the week. Increased feelings of hopelessness about your situation, about your mothering skills, about your future in general, increased anxiety and increased feelings of panic beyond your usual levels of anxiety, significant changes in your appetite in one direction or the other, noticing sleep disturbances like insomnia, difficulties falling asleep, staying asleep, or waking up too early. And look, I know you're going to say, look, I have a new baby. Of course I'm going to have sleep disturbances. But I'm talking about even when, if you're fortunate enough to get a break from childcare and you can actually have time to sleep, you're still having sleep difficulties. And it's the depression itself that's driving the insomnia, not necessarily childcare related duties. All right. Now, other symptoms include increased feelings of worthlessness, increased and persistent feelings of guilt. Oftentimes these may be surrounding the topic of your mothering skills themselves. And again, this is something that's beyond your usual level of self-criticism or guilt. Other symptoms include increased isolation. So again, look, I get it. When you have a newborn, you're not going to be doing your usual leisure activities or hanging out with people as much because of childcare. But I'm even talking about emotional withdrawal. So internally, you're not feeling as connected to your spouse or partner, your family or friends, and are somewhat just even emotionally withdrawn and feeling detached from people. In addition, some of the more concerning symptoms are going to be things like suicidal thoughts. So thoughts of wanting to kill yourself, thoughts of suicide, thoughts that you're better off dead, you want to be dead, you have thought about plans or methods of how you would do it, you actually have suicidal intentions, or you've even tried to attempt suicide. Another one that makes people nervous and scared to talk about, but look, as a psychiatrist, therapists out there are used to talking and hearing about this, are thoughts of infanticide. So not harming yourself like thoughts of suicide, but thoughts of harming or even killing your child or your baby. Again, this doesn't mean that you want to do this or that this is your heart's desire, but it's not uncommon that women will experience some thoughts of harming their child as a sign or symptom of postpartum depression. And look, again, it's not something that people will often admit to, but even women who are not going through postpartum depression but are stressed out and feeling overwhelmed may have transient thoughts like this, whether they want to admit it or not. So again, this doesn't cover every single nuanced symptom, but these are some of the most common signs and symptoms of postpartum depression. Now, a rare symptom can be postpartum psychosis. And I'm going to preface this by saying postpartum psychosis is actually more often associated with patients who have bipolar disorder or undiagnosed bipolar disorder, but in a small percentage of postpartum depression, even in non-bipolar patients, you can experience postpartum psychosis. So this is a form of temporary psychosis, which can include symptoms like hallucinating and having delusional thoughts. So having fixed beliefs in things that are not based in reality, like paranoid delusions, all right? So this is not necessarily a sign that you're going to have some kind of long-term psychosis, but if the postpartum depression can become severe enough, you may temporarily have psychotic symptoms until your depression improves. Now, one of the next questions I get is, what is the biology or what is the biological cause of postpartum depression? I'm going to save us some time by saying there is no clear-cut answer that we can say, like, this is the definitive reason that women experience postpartum depression. In recent years, we've come to the conclusion that a percentage of women, may experience postpartum depression because of some of the extreme hormone fluctuations that occur right after delivery of the baby. So during the third trimester of pregnancy especially, some of the female hormones like estrogen, progesterone, and allopregnanolone are really super high, and right after delivery, they plummet. I mean, immediately after delivery, they plummet. And we believe that for a percentage of women out there, this may be a cause or a contributing factor. Now, another question I get is, who is at risk or who is at higher risk of developing postpartum depression? Now again, what I'm going to list is not necessarily cause and effect, but these have been risk factors that have been associated with a higher risk of developing postpartum depression. These are things like having a history of prior episodes of postpartum depression, having a history of major depressive disorder, bipolar disorder, substance use issues, if you've been going through depression right before or during the pregnancy, if this was a unplanned or unwanted pregnancy, if you felt that you did not have support or a lot of help during the pregnancy or after the pregnancy, having significant financial stress, significant relationship stress, all of these things can be contributing risk factors for developing postpartum depression. Now, the next question is, what are the common treatments or approaches in treating postpartum depression? Typically, they include psychotherapy, meaning talking to your psychiatrist, therapist, licensed clinical social worker, pastor, support group, and doing talk therapy or group therapy to help you get through your depressive episode. The next is medicinal options. Traditionally, these are going to be things like antidepressants. And again, these are antidepressants that are used in treating even non-postpartum depression, things like SSRIs or selective serotonin reuptake inhibitors, things like Prozac, Zoloft, Lexapro. And these are the primary prescription medications we use to treat postpartum depression. There's been a recent breakthrough in 2019. For the first time, we had a new novel treatment that is not an SSRI, that is not a copycat drug, that's been approved to treat postpartum depression called Zulresso, which is an IV or liquid form medication called IV brexanolone, or Zulresso is the brand name. And this is a breakthrough in the treatment of postpartum depression, and we can cover this in a new video, but these are some of the options that we have. Now, the final question I'll tackle before we wrap up is, in addition to therapy, meds, support groups, a combination of all of the above, what else can I be doing on my own to kind of address some of this? Well, the list is going to be very long, so we'll just go through a few quick tips that I'll leave you with. And the first is, and I know this is a big ask, is sleep. And I know that's a big ask. Mothers out there, you know what I'm talking about. It sounds so obvious, but easier said than done. But can you get some sleep, some consistent sleep to help you rest, to help you recharge? Because look, if you're not recharged, taking care of a baby, getting through the day, working, going to be that much harder. Okay, life is hard enough when things are going smooth and you're well rested, let alone if you're not sleeping and you're struggling with postpartum depression. The next tip after sleep is, don't go through this alone, okay? And for those of you who don't have anyone out there, I know it's hard, and this may mean you need professional help versus leaning on friends and family, but if you can, this is the time to lean on friends, family, obviously your partner, your spouse, your church pastors, support groups, whoever it may be. Ask for some help, ask for some support. Hopefully you don't have to demand it, it's already being offered to you, but if not, speak up, demand some help, because you don't want to be going through this alone and feeling like you have to raise this child 100% on your own sole efforts, okay? The next and final piece is, please ask for help. Please speak up, speak up, speak up, and speak up and ask for help. Because like I said, Look, the CDC estimates that about 1 in 9 women will go through postpartum depression after delivering their baby. I believe that is a gross underestimate, okay? That 1 in 9 are those who are willing to speak up and who have access to resources, in my opinion. And the reason that a lot of women and mothers don't seek help, there's a variety of reasons. Number one, you don't have access to care. You have limited resources. And also cultural factors and stigma. Okay. I think our society has built up this expectation and notion that after delivering a baby, it's supposed to be this gleeful, happy, beautiful time, and you see all these Instagram and Facebook photos of newborns, and they're cutely posed, and you're holding them, etc. But look, all mothers out there know this, whether you want to admit it or not on social media, is that it is tiring. You are, sleepless. You are stressed. It is beautiful, but stressful at the same time. And I want you to know, so you're not in this alone. Okay? If you had feelings that I'm having troubles bonding with my child, I'm not as happy as I thought I would be. I'm feeling sad. I'm feeling overwhelmed. I'm feeling stressed. I'm so tired. You are not alone. You are not alone. So I want you to speak up. I don't want you to fight through this by yourself. I want you to seek some help, because there are people out there in your life and professionals who want to help you and are there to help you. So look, I know that was a rapid fire overview. I'm going to try to do a few more postpartum related videos to go into more details into some of these other topics, like what's the difference between the baby blues and postpartum depression, more details about the treatments. How am I supposed to get treatment if I'm breastfeeding, and will that affect the baby, etc. So look, I hope you found this helpful. Please like, please subscribe, please share with others if you found this useful. Dr. Andrew Kim, I hope everyone is safe, be happy, be well. Signing off, until next time.